Hello, everybody. Thank you for joining us. This is the Partnerships to Address Tobacco Use Among MSAWs, or Migrant Seasonal Agricultural Workers. We are the National Center for Farmworker Health. We are a private, not-for-profit organization located in Buda, Texas, whose mission is to improve the health of farm worker families. We have population-specific data resources and technical assistance. We have workforce development and training, health education resources and program development, board governance training, as well as program management. Here we have the Ag Worker Access Campaign. It's a national initiative to increase the number of migratory and seasonal agricultural workers and their families served in community and migrant health centers. And we've put the links in the chat for you as well. Today's speakers are myself. I am Jocelyn Suarez. I'm the Qualitative Research Coordinator for the National Center for Farmworker Health, and I'm joined by my wonderful colleague, Esli Reyes. So let's go over some learning objectives for today's webinar. Today, you all will receive hands-on assistance and guidance in creating a plan to build a tobacco cessation task force. Y'all will learn how to identify, recruit, and integrate community partners into their task force using various NCFH tools. You will also receive information and tools for building strategic partnerships to provide comprehensive care, support, and resources to strengthen tobacco cessation initiatives and interventions among the MSAW population. So let's go over some ways that tobacco use affects the MSAW population. In general, health effects such as lung cancer, blood clots, diabetes, COPD, gum disease, and tooth loss are very common with tobacco use. And specifically for the MSAW population, job performance issues such as breathing troubles, fatigue, increased anxiety, and decreased concentration. Another issue is possibly more sick days and missing work, which we know the MSAW population really worries about when it comes to getting to work on time and getting to work every single day. So what are some of the benefits of reducing or quitting tobacco use, and how can it help the MSAW population? Well, with reducing or quitting tobacco use, you can expect to live longer and enjoy good quality of life. You can expect healthier lungs, less shortness of breath, less cough, more stamina. It can also protect loved ones from sickness due to secondhand smoke. And it also saves money due to the cost of cigarettes or cartridges with vapes. So knowing all of this info, this topic is really important to NCFH because of our history and mission to improve the health of farm worker families. Smoking and vaping is detrimental not only to the self, but also to those who consume secondhand smoke. We have conducted research and are in the midst of reporting, technical training, and resource development on this topic, actually. So due to the need of more research in tobacco use in the MSAW population, we conducted an environmental scan with grant funding from HRSA and completed focus groups. In October of 2023, we conducted a poll with federally qualified health centers. And starting in January 2024, we conducted 3 separate focus groups. These focus groups were composed of 16 current and former MSAW smokers, so former smokers, current and former smokers, and 5 were non-smoking companions of MSAW smokers. So these are friends, families, coworkers, those who have a direct connection to someone who is a smoker and an MSAW, and they themselves are also a migrant seasonal agricultural worker. Focus groups were qualitatively analyzed and findings were summarized, and a final report with all of the information is expected within the second quarter of the year. Here on to the right, you can actually see a quote from one of the participants in our focus group. I have translated. Feel free to read either. I will be reading the English. They say, "Oh, well, when I started to smoke, no, there weren't any of those that there are today. It could be the only one that was available were cigarettes. But since then, I've started to see a lot of different products." So this farm worker specific, or this agricultural worker specifically is noting how in their experience, it's mostly been cigarettes that were used for smoking. But nowadays, there's actually quite a lot more vaping and cartridges being used. So let's go over some of the findings that we found with the focus groups. One of the largest things that we found was that smokers are well aware of the health risks when it comes to tobacco use. They are usually introduced by friends and family, and it's a cultural, familial experience. They continue to smoke because of perceived benefits. One of the most common perceived benefits among the focus group participants was mental health. Many of them said that it helped them with anxiety and with stress. There is a link, we found a link between smoking and alcohol and other drugs, most commonly marijuana. This may be due to the environment or family or cultural. And then family and other relationships are tense with non-smokers. There is a tension between non-smokers kind of hoping or pressuring their smoking companions to quit. And we have another quote here from one of the participants. I started to note that when I worked on the 4th floor, well, I needed to take the stairs for my health, right? But I started to note that I couldn't keep taking the stairs. I started to question having all of that in my system. So this participant was discussing how when they were working at a place with multiple flights of stairs, their stamina, their ability to get to the top was exhausting them faster when they started, in their case, actually vaping. Some other findings is that in the MSAW smoking population is rarely discussed. They rarely discuss cessation with doctors. This was due to a fear of reprimand, and also because they stated that regardless of what the doctors would say, they will continue smoking. So they found those conversations futile. Participants who have quit discussed reasoning for quitting, such as for health benefits, for their children, for seeing the health effects on others, and monetary benefits. Particularly with the seeing health effects on others, participants noted that friends of theirs who had been smoking for a long time, they could see them either getting cancer diagnoses or having physical effects. And this worried them and convinced them to cessate. Many of the participants actually offered alternatives, substitutions, and motivation for quitting. They said that these aspects, alternatives, substitutions, and motivation, were the key determining factor for them quitting. Participants also described slowly quitting or substituting the ritual with sports. They also discuss withdrawal issues and ways to combat them. Another quote that we have is, little by little, you'll quit smoking. First, if you smoke 3, we'll smoke 2, and then smoke 1, and then all at the end, nothing. So this is one of those quotes or participants who describe slowly quitting, right? They're actually explaining their process where they started with the normal amount and then reduced over a period of a few days. So while we know that improving cessation rates is a big issue, that affects ag workers and their families, it cannot be done alone. That's why partnerships are so critical, and which is why my colleague Esli will discuss.
Thank you so much, Jocelyn. Hello, everyone. My name is Esli Reyes. I'm the Health Education Products Manager here at NCFH, and I am so happy and excited to be here today presenting more about building partnerships and forming task force, and specifically talking about issues of tobacco use among MSAWs or agricultural workers. We can go to the next slide, please. So let's start with a question. Can you describe partnerships with one word? Feel free to use the chat. Any word that comes to mind when you hear partnerships. And I'll give a couple seconds. Collaboration. Thank you so much. That's a good one. Yes. Any others? Unity, teamwork, resources, organizing. All those are great. We've been doing a couple of training and technical assistance in regard to partnerships, and some of the others we have heard are synergy, alliance, cohesion, integration, and all of the ones you said are perfect and they are so fitting. So one thing we know for sure is partnerships involve many hands on deck, as the graphic here on the slide, right? Many hands on deck to accomplish a certain goal. And that's where we're going to focus today. So we can go to the next slide, please. So to start off and to fully understand the type of partnerships we need to accomplish a goal, it is important that we step back a little bit and recognize and highlight what are some of the challenges that agricultural workers are currently facing. And I like to highlight their SEOHs, which are social drivers or determinants of health, which we know are conditions in the environments in which they born, they live, they work, they play, they worship, they age, that affect a wide range of health functioning and life outcomes and risk, right? So these resources could enhance or diminish the quality of life of agricultural workers and can have a significant influence on population health outcomes. So we can go to the next one. So when we think about these different categories and we think about our population, agricultural workers, the unique challenges are barriers that might not enable them to achieve a good quality of life and health. So when we think about education, access, and quality, a lot of them might have limited formal schooling, low literacy levels. When we think about economic stability, they might have be under poverty levels, lack of employment benefits. When we think about social and community context, community and workplace barriers, and for example, a lot of the times they live in isolated or in food deserts where they cannot access healthy foods or cannot safely exercise. A lot of them face immigration system and laws. They lack awareness of challenges when we think about healthcare access and quality. Some of them may lack health insurance. They might have limited understanding of the health system, specifically in the US, that might be very complex to some. They might have unique health beliefs and cultural practices. Again, they might be very far away or in isolated areas where they may have limited access to healthcare sites. And when we think about their neighborhood and built environment, well, they might lack transportations to access healthcare. Transportation, when we're thinking about tobacco, to access a support group, to access maybe a tobacco cessation intervention. Some of them might have housing that might not be accessible, that might not be safe, right, where they're living. And of course, they might also be facing food insecurity. So it is important for us to have this kind of refresher of these barriers. And I want to do this exercise where wherever you're at, you think about the specific population or patients that you're serving, because as I was mentioning some of these barriers, maybe some of these ring a bell. And this is important. And it's a very important step for you to start thinking about what kind of partnerships will help you kind of meet the goals and help you overcome these challenges that they might be facing. So we can go to the next one. So out of all the challenges, I wanted to take a little bit of time to highlight those that uniquely affect and contribute to ag workers using tobacco. So as we know, the nature of their work, their constant mobility, them working isolated, sometimes being isolated from their families, contribute to stressful work environments. We know agricultural work can be very physically demanding. They work long hours, often perform under challenging weather conditions, and this can lead to high levels of stress among workers, and some may turn to smoking or using any kind of tobacco as a way to cope with stress. Then we have social norms. Smoking may be more socially accepted or even encouraged within agricultural communities, and this can lead to higher rates of smoking initiation and continuation while they're working on a certain farm or job. Then we have isolation. Agricultural workers often work in remote rural areas. They're away from family, and this can contribute to feelings of loneliness and can increase the likelihood of them smoking as a way to pass time or alleviate the feelings of isolation. The other one is limited access to healthcare services. I think this is linked to what we just mentioned. A lot of the time they live very far away. They might say, well, I might seek care, but I don't have transportation. Or if I go to the health center, they might not speak my language. Or maybe they do speak my language, but they use very high literacy words. I don't understand what they're telling me. So that limited access to healthcare services can inhibit them, right? And contribute for them to start using or continue using tobacco. Then we also have the financial stress. So many agricultural workers face financial instability due to some of them have seasonal employments, low wages. A lot of them actually do not have paid sick leave. So if they decide to take a day to go get screened or tested or support, they might be losing that income that is very important for the well-being of themselves or their family. A lot of them do lack education and awareness of the health effects and impact of tobacco. And a lot of the times we might think, well, we see tobacco cessation interventions and messagings everywhere, but we need to think about our population. Is it in their literacy level? Is it in their language? Is it in places where they go and they understand? Is it explained correctly to them, right? Where they can understand the full effects of tobacco? Sometimes not. And so this is a unique challenge that they face. Then they have cultural factors. With certain agricultural communities, it could also be linked to their religion. It could also be linked that as a tradition since they were small. So a lot of them face these challenges, right? And overall, addressing these unique challenges requires targeted interventions that take into account specific needs and circumstances of agricultural workers. So as we think about all of these challenges and barriers, well, think about your organization, whether you're a health center, whether you're an agricultural worker serving organization, community-based organization, maybe you're a university today, wherever, whatever your organization might be. Think about it. Do you have all the resources, all the knowledge, all the staff to be able to cover all and address all these challenges? Well, very likely you don't. And this is why partnerships are so important, because they kind of like a puzzle, they will fill the gaps that you might not be able to fill alone. And this is why it's so important to kind of highlight, right? What are some of the areas that I need this support, and what are some of the areas that we're so strong that we can offer this support to other partners? So we can go to the next one, please. All right, so to overcome these challenges and help agricultural workers reduce or quit tobacco use and increase education, awareness, access to care, and overall support, well, we need many hands on deck, right? That's how we started. We recognize that there's a lot of support that we need to give and receive to accomplish such a big goal. So we can go to the next one. And these are called partnerships or collaborative relationships, right? So collaborative relationships provide the opportunity for organizations to work together towards a common goal or purpose. When we think about SDO ages and the unique challenges that we mentioned, it broadens the opportunity to access services for special and vulnerable populations like MSAWs. It also allows for a more integrated approach to identifying and tackling these barriers. We can go to the next one. So partnerships help accomplish goals, yes, objectives that we would not be able to do on our own. And partnerships can also help us expand our knowledge, skill set, expertise. It helps us increase resources. Maybe we partner and we increase our funding, maybe our time, or maybe the partnership has a staff, a key staff that you don't have, but together you can work together, improves visibility of a cause or a goal, and expands our reach, reaching a broader audience, specifically when we have certain educational campaigns. But one important graphic that I always like to highlight is that it is a two-way street, right? Partnerships, each partner should complement each other to form collaborative relationships. We always mention, oh, well, what is our ROI or return on investment? And the same works for partnerships and collaborative relationships. In order for them to be successful, you need to always acknowledge what are you offering to that partnership and what are they giving to you. It should be a mutualistic and beneficial partnership, just as the graphic says here. It's a two-way. I give and I also receive, right? All towards the same goal of helping agricultural workers with quitting or reducing their tobacco use. So we can go to the next one. And I have another quick question that you can answer in the chat. And the question is, how can partnerships work to support MSAWs who are struggling with tobacco use? And this is specifically if you are currently working with a partner, or if you have any ideas in mind of how can partnerships work specifically, maybe a certain activity or a certain intervention. And I'll give a couple seconds to see if y'all have any ideas. Yes, frequent health education classes. That's right. And that's one we were going to cover. Yes, that is a way. Maybe I see an attendee mentioned medication. Maybe we partner with an organization that can help, explain the extent of the medication in a lower literacy level, maybe in the language of the patients with visuals. All those answers are great. And we're going to review just a few of the partnerships that we have seen successful across different health centers and ag worker serving organizations. So we can go to the next one, please. All right, so the first one and a big one is access to healthcare services. I keep on referencing back to the challenges because they're very important, because those are kind of like our guide. What do we need to do to overcome the challenges? But one of them that kept coming up is access to healthcare services, whether it's they living in isolated areas, them not having transportation. So collaboration with community-based organizations or other healthcare facilities to improve access to healthcare services for MSAWs might be a good strategy, right? A lot of health centers are currently doing mobile health clinics, kind of reaching agricultural workers where they're at, maybe to do screening, maybe to do education, maybe to do any other kind of support groups, etc. In the mobile health clinics of reaching them where they're at, they are partnerships that are providing interpretation services. Some of them also are, maybe they don't have a mobile clinic, but they are working with their local transportation organizations or businesses to offer transportation vouchers to get what they are, right? And these are just some ideas of how partnerships have worked to access healthcare services. We can go to the next one. The next one is hosting support groups and counseling sessions. It has been expressed that after a tobacco cessation intervention, whether it's at a health center, a clinic, you need that kind of follow-up, right? It is a program, it is a process. So a lot of the time, a health center might not have the capacity to host support groups and counseling sessions in-house, but this is where a partnership can come into place. Maybe partnering with community center or a religious institution to host these support groups or counseling, maybe something that is closer to them, a community library, churches, etc., can help kind of bring this awareness and follow-up support to agricultural workers. And one thing that we have seen in a recent learning collaborative is a lot of these kind of support groups and counseling sessions might be happening via WhatsApp, right? Virtually. We always think about agricultural workers not having the flexibility probably or the regular work hours to meet at a 5 p.m. class or 3 p.m. class, but a lot of them are taking it into a virtual aspect or strategy and are using WhatsApp to offer these groups as well. So it's a strategy or a partnership that can help address tobacco use as well. We can go and see another example. So, and this one is one that you mentioned, which is education and training programs. So collaboration with educational institution, we have every state has an agricultural extension service, maybe a community-based organization, maybe a college or university that has a branch on health education to design and deliver educational programs that address the health and tobacco use specific challenges among MSAWs. Maybe as a health center, you have the clinical aspect, but you need that support and that partnership to fill the gap of education in a way that is culturally and linguistically appropriate. So this is a great partnership that you can form, right, with these organizations that might be around you and support you on this overall strategy. So we can go to the next one. So we have community empowerment and advocacy. So collaborate with agricultural and local leaders to facilitate community engagement, education, and capacity building initiatives that might support the well-being of MSAWs, right? When we think about tobacco cessation, a lot of maybe campaign and awareness might be needed. Now, when we think about agriculture workers, they might not know to the full extent the challenges that it might do to their health, and not only to their own health, but to their family, right? Secondhand smoke. So kind of increasing this community empowerment advocacy. We have heard health centers partnering with local businesses where they are putting messaging that are easy and clear to understand in their billboards or maybe outside their businesses. So all of these are partnerships that can contribute to that main goal. We can go to the next one, please. So as we know, a lot of health centers are currently doing SUH screenings. And I know there are a lot of tobacco-specific screeners that can help you identify when a patient, specifically an agricultural worker patient, might be having a problem or an addiction to tobacco use. And while this is important as a health center to identify, this is where partnerships are key, right? To provide this continuum of care. So if I have a patient that has expressed that they're using these many numbers of cigarettes a day, and I discover or they express that they're using it because they feel lonely or because they feel very stressed. What do we do after that, right? And what do we do provide this continuum of care if sometimes as an organization, we might not have all these resources, right? So it's important to think, and I just wanted to plug in the SUH screenings and tobacco specific screeners because I know a lot of them are required to be done by a health center. But partnerships are important when we think about, okay, what happens after the the patient goes out the door? How are we supporting and how are we doing that extra step to provide that continuum of care? So, and here I just mentioned a few, and a few other strategies, and there's some that have been expressed by health centers that have attended some of our learning collaboratives. Another strategy that was mentioned was sometimes when health centers want to offer virtual care, they have partnered with internet services or businesses to provide a modem or an internet or Wi-Fi to these people, to these agricultural workers that might be away, might not have virtual capabilities to connect to visit a health center or do telemedicine. Some of them have even formed partnerships with their local libraries. So agricultural workers can go into their local library close to them and they can connect, right, and do appointments with health centers. Some of them also have worked with ride-sharing companies such as Uber or Lyft to provide vouchers to these agricultural workers so they can use and not having to spend their own money so they can access healthcare. And these are just some, as you see in the screen, some other strategies that partnerships could work to meet these needs, right? And get together and achieve this goal. So we can go to the next one. So we have already talked about some strategies on how building partnerships can help you achieve all this goal and overcome these challenges that agricultural workers are facing. But now, Esley, tell us how you build these successful partnerships, and this is, I think, the fun part of our webinar. So I encourage you to ask any questions along the way. I also encourage you to ask any, to have a pen and paper to take some notes, because our hope is that through the following slides, you can at least get a head start to, one, assess your current partnerships, or two, to think about how to build these new partnerships that will help you push these efforts forward. So we can go to the next one, please. So when we think about establishing collaborative relationships, there are four main questions that you should be asking yourself as an organization. One, to a capacity, most of us already have partnerships that we're working with, right? So sometimes we're going to see a collaboration spectrum in a bit, but sometimes a partnership could be a simple referral. A partnership could be you cross-promoting some resources and services. And it's important that you start thinking about, what do we already have? What partnerships that we already have that we can push forward to the next level? Then thinking about the challenges specific to your population, the next question is, what new partnerships do we really need to fill these gaps? I see that the agricultural workers that we're serving are struggling with transportation. I'm looking at my current partnerships and none of them can offer me that support. So where do I need to look to fill this gap? So that's number two. Number three is, okay, so I have a list of potential partnerships, but what are the specific characteristics of these partnerships that aligns with my organization, aligns with our goal, aligns with our mission? And the last one is, in what capacity will we work with these partners, right? So at that point, when we get there, we're going to talk about different types of partnerships, whether they're coalitions, they're one-to-one partnerships, they're task forces. It's strategically smart to choose the way that you're going to work with these partnerships to accomplish your goal. So let's get started. Let's go to the next one, please. Okay. So let's think about what partnerships you already have. And this is analyzing existing collaborative relationships. So we know collaborative relationships are very diverse, and their nature depends on the needs and goals of each organization. We know that as the need of communities evolve and new challenges arise, I always like to mention COVID-19. There was a new challenge that popped up out of nowhere, and there was a lot of adjustment. it is important at this time. So when there's a new challenges, or maybe it doesn't have to be such a big pandemic, but maybe it's a new challenge within your community. It is important to analyze and evaluate the strengths and challenges of your existing collaborators. It is also important that depending on the efforts, a collaborator might be used into different capacities. Maybe the different staff or departments and organizations are using different capacities as well. And this will help you identify collaboration gaps in any new organizations or services that can help you accomplish your organizational goals. So we're going to go to the next one. So as you're analyzing existing collaborations, there are a couple questions that might help you guide this analysis, okay? So the first question is, reflect the diversity of your target population. Is your organization or your current partner serving everyone that you serve? All the patient and the diversity is everyone sitting at your table able to meet the needs of every single one, every single population, different ethnicities, different language, different cultures? Do they represent the community sectors of interest for you? Do they bring unique expertise, resources, and perspectives to advance your goals? What is unique from them? Why is it that you need them? Do they benefit from the work your organization does? And this is where the two-way partnership comes into place. And this is very important because we have seen an increase of success when there is a mutualistic benefit, right? They see a benefit of partnering with you too. And do they fall on the positive side of the collaboration spectrum, what you see on your right? And this is a graphic from Tamarack Institute. And it's really nice because you see a gradient. So on top, you see a minus, bottom, a plus. And as you go down, the trust and collaboration effectiveness increases. And here you can see the different levels that you might be collaborating. So at the top, you see compete. Well, this is competition for client, resources, partners, and public attention. I won't say it doesn't work, but it is very less likely that a partnership could be successful if the other organization is doing the same thing, exact same thing as you. But one thing we always say, there's always a little entrance of differentiation between you two that you can still complement each other, but it is on the lower end of the spectrum. Then there's some that coexist. There's no systematic connection between agencies. And then we have communicate. Here, there's some inner agency information sharing or networking. Then we have cooperation as needed, often informal interaction on discrete activities or projects. Maybe you send an email out. And then we have coordination, right? This is kind of where we want to be with our partners. There's groups and organizations systematically adjust and align work with each other for more significant outcomes. Then we have collaboration, longer term integration based on shared mission, goals, decision making, and resources. And then we have a full integration where you have fully integrated programs, planning, sometimes funding. And now there is not, I guess, a set sweet spot. It just depends on the needs of your organization and your and the population that you are serving. We always say cooperate, coordinate, collaborate, integrate is where we wanna aim, because this is where the success has been seen, or any kind of collaboration towards a goal. And something to mention as well, as we start going down the gradient and the trust and collaboration effectiveness increases, it is a more formalized way. At this point, there's a lot of MOUs, memorandum of understandings. There's a lot of official collaborations happening. And this is where we're later going to talk about task forces, coalitions, etc., where there are set goals, set guidelines, leaders, etc. Yeah, but we can move to the next one, where we're going to move to the second step. So we hope that this first step helped you at least see, okay, I listed on the top of my head, I have 4, 5, 10, organizations that we're currently working. These organizations might be at this level, maybe we're collaborating, or maybe on some of them we're fully integrated, but I still see this challenge or this need in my community and my population, and I don't have anyone sitting on my table to help achieve these. So this is the step that you want to be in and ask, okay, what new partnerships do I need? And identify potential collaborative relationships. And at this point, we want to introduce you the asset mapping tool. And you can just go directly and find the link in the chat right now. Thank you, Vanessa, for sharing. And asset mapping serves to identify and document a community's existing resources, services, and key partners. Mapping these assets can help build new connections within your service area, highlight SEOH barriers, and develop a reference tool to address these barriers. So hopefully, and all these resources will be shared with you after the webinar as well. But if we go to the next one, in this tool, you're going to find a step-by-step that will guide you to find or identify these partnerships around you. It also has an interactive tool that will take you to a map for your specific location or community to start locating these places that might contribute to your goals. So I want to take you back to when we started and we talk about these different challenges and SEOHs, and think about those, because as I was mentioning a lot of the different challenges, you probably had a couple in the back of your head specific to your community, specifically to your patients. So now look at table one, and this is extracted from this tool, and we're going to think about these challenges that they might facing, and we're going to think about this community resources that might help you achieve those goals. So just give me a minute. I'm trying to pull it out right here. So, for example, if we are trying to do a big campaign, tobacco cessation campaign, I know that a challenge is that my agricultural workers that I serve, they don't speak English. They might not even speak Spanish. Maybe they speak an indigenous language or a dialect that I don't understand. But hey, I know in my community, so I know they have a language barrier. In my community, there is a radio station that speaks that language, right? So how can I connect with them so I can look at the top right-hand social and cultural organizations, radio TV stations, and how I can connect with them. You know what? We know that we need to expand education for this population, but I'm having trouble finding where they are. You know what? And I've heard and I know our local food bank is very well attended, right? So that's where I can go and provide health education. So you can look at emergency services and think about partnerships like the food bank that can help you take that organization. So this really, when you go through this asset mapping tool, it is very eye-opening, because sometimes when you just think about partnerships, you can just think about 3 or 4 that are very popular, very alike in a line of the work that you do. But when we step out and think outside the box, we start thinking that there is a lot of different organizations that working together and complementing our work can provide a bigger impact to the challenges that this population might be facing. So we can go to the next one, and hopefully you had a chance to click on it and open it, and if not, you'll have a chance to do it later, but you're able to enter information and take notes. So with thinking about specific tobacco cessation partnerships that we can have, I went through an exercise looking around my community. And by the way, I'm located in South Texas, the lower Rio Grande Valley. And I was thinking, okay, so if I am, as an example, a health center that is offering services and we're screening for tobacco use within farm workers or agricultural workers, and I want to offer I want to expand my efforts, I want to provide that continuum of care. How can I do it? So I started looking as an exercise around me. So again, for social and cultural organizations, if I wanted to partner and provide support groups or education. I know that a lot of the farm worker agricultural communities are close to this church called Lucy Vida Church, right? They might not be able to come to my health center, but I know that I can partner with this church and we can take the education closer to them. This is a place that they trust. This is a place that they attend often, right? That maybe we can ask for a space, right? A partner in that way. I also mentioned Radio Latino. If I wanted to have a PSA or education, or maybe have one of our doctors go, and I know they have some interpreters there, but we know our population listens to the Radio Latino, and it's a way that they can understand or be more aware of the effects, health effects that tobacco use can make. Then I also thought about the neighborhood resources, right? We do have a city metro, right? It's a bus, and it is very low cost for everyone, for the community, but it could be low cost for agricultural workers. But maybe they can also offer some vouchers, or maybe I can connect with the city metro and the city council, and we can do a stop here by our health center, right? Where the farm workers can get directly to access care and more. Also, we thought about emergency resources. I think I mentioned we have a Rio Grande Valley food bank, and also they have satellites, pantries. So we can think about, hey, do they have a satellite pantry close to the communities that I'm serving, where we can go and provide screening, provide resources, provide support, and connect with them. We also talk about health centers. So any local hospitals or health centers that can contribute. Unfortunately, not all health centers might have outdoor outreach workers or community health workers that can expand or provide this culturally appropriate health education, but maybe a partner health center might be doing it, right? So thinking about that, how we can kind of achieve, maybe you're a health center that do not have any tobacco cessation programs or initiatives, but you know a local hospital, a local health center does, and maybe we can partner, use some kind of referral system. And then for education, again, maybe thinking about a local library. We have heard from health centers, even laundromats, where we know that our agriculture workers visit and their families. So maybe just leaving some posters there, maybe playing, there's TVs. Some of them mentioned they have TVs and we play educational videos there. So it really, opportunities might be endless when you think about that. All those hands in deck, or all those challenges do not fall on a single organization, that you can count on partnerships that can strategically and uniquely help you achieve these goals. So with not further ado, so again, if there's any questions that you might have after you access this tool, you can ask them in the Q&A. And also, if when you're implementing, you need any kind of technical assistance, we're also here to help you. But we're going to move to the next one for the sake of time. Okay, so let's say in step 2, you identify, and I'm going to use some of my example, which is Lucy Vida Church, right? And you identify some new organizations that you might go and knock some doors, right? And have a proposal of partnership. It is important that you learn a little bit more, or specific characteristics that are aligning with your goal. And for that, we have an Ag Worker Access Partner profile, and that resource was just shared in the chat. And this literally helps you go step by step to get to know that organization. So every organization has, apart from their unique tobacco cessation goals, have unique values and missions, right? So a lot of the time, as a requirement for each organization to partner is to look, are they aligned to us? Are they aligned to the work that we do? Are they aligned to the population that we serve? And this one will help you fill out their information. It also helps you kind of find their population specific characteristics to ensure that they have that common vision, their services and resources that they provide, and all of that. And it is a recommendation at this point that you might have to pick up Either do some online research or pick up the phone and ask these questions. And this is a good time invested because if you're already analyzing and pinpointing these organizations, you want to ensure that if you invite them to your table, they are going to really meet those needs, right? And meet those needs that you have to accomplish that goal. So if we go to the next one. So this is the Ag Worker Partner Profile Review, and here you can see it a little bigger, but it is an interactive tool that you can enter all the information, you can take notes, and we recommend that as you are identifying these potential partners that you create one of these and fill it out and analyze and see if they're a fit to your organization before you go to the next step, which will be already creating and inviting people to sit with you at your table and forming these collaborative relationships. Next, please. All right, so step one, we analyze who we had. Step two, we identify what could be good partnerships with other organizations. Step three, take us deeper to understand each organization in alignment. And step four is how will I network with these partnerships? How would I work? Okay, I analyze them. I know they're potentially good to meet our goal of tobacco use with agricultural workers, but how would we work with them? So there are different type of collaborations. So we have coalitions, we have task forces, we have one-on-one partnerships, we have referral networks, and they can be used differently to address SUH barriers for MSAWs. And they're very unique. And that's why I always go back to it is uniquely to your needs and the organization, to the needs of your organization and the population that you're serving. They, of course, depend on the goals and objective each partners want to accomplish. So we go to the next one. So when we think about the different types of collaborations, here we have coalitions, partnerships, and referral networks. And we're going to talk about task forces next. So examples of coalitions, they are usually broader goals. So local coalition that we have is coalitions to ensure MSAWs have access to healthcare. That is a big goal. And within that coalition, there is dozens of organizations working together because they have a lot of sub goals, which might be task forces. I don't want it to get confusing, but coalitions are usually a very broad goal that requires a lot of organizations to work together. We have coalitions to bridge the gap of lack of transportation among MSAWs that might go around, across several counties, how they're working together just to meet that goal. Those are usually bigger goals. And a lot of the times their coalitions already happen when you're within your community that might be beneficial for you to plug in, right? And see how you work into this bigger strategic goal. Then we have what we call mutually beneficial relationships or one-on-one partnerships, right? So we have migrant health centers partnering with local food banks, migrant health centers working with schools to provide health screenings at school events, etc. So these are kind of like a one-on-one. Most of the ones that we mentioned so far were these kind of partnerships. And then we have referral networks, right? And this is what it sounds like, referring your patient to another organization to receive a further service or education. So we have a clinic referring MSA patients to legal service agencies to obtain immigration assistance. That might be a fear that they have that may inhibit them to access care. Faith-based organizations referring patients to health centers to receive healthcare. And this is actually a referral that we have heard from a health center and saying that religious institutions are a place where agricultural workers trust and a lot of the time where they seek help and support. And of course, as a religious institution, you might not have some do, but you might not have the health and clinical aspect of it. So that could be a referral system, how they can send those patients to your clinic so you can offer that care that they need. So this is kind of a referral network, and it works both ways. It could be beneficial for you to refer out, but it could also be beneficial for your partnership to send the patients into your health center so you can offer that clinical care. So, and then we can go to the next one. We have task forces, and I wanted to focus specifically on tobacco cessation task forces. So task forces are usually often created by a governing body, organization, or agency to address a particular issue. So they're very specific. The goal is very specific. So in this case, let's say tobacco cessation among MSAWs in a certain location, right? Wherever you're at, in your city, in your county. And or they accomplish a specific mission with a defined time frame. So usually task forces are time bound. Sometimes I have seen some that are a couple months and some are a 3 year, right? And then there's some renewals with shifts in goals, but they're usually very clear, very particular goals, and they are defined and time bound. They're typically smaller and more specialized than coalitions, so they are very strategically targeted partners. Within their goal, they're partners that will help achieve that goal. So I did mention some larger coalitions of accessing healthcare, and they might have smaller task forces. Maybe one of them is for transportation, the other one is for language access, etc. And everyone forming or being part of the task force are specifically linked, and their expertise and resources are specifically linked to that goal. They involve representatives from different organizations or agencies, and their roles and responsibilities are typically narrowly defined. Again, everything is very specific. They have a clear set of objectives and deliverables, and they are expected to work intensively and collaboratively to achieve them. And at this point, what we have seen as a training and technical assistance partner is that when task forces are formed, they're usually very formalized through MOU. Sometimes they do share some funding, but these are very established partnerships working together. They have timeframes, they have deliverables, they have reporting periods, they have times that they have to go and present results to maybe apply for a grant. So all these can come within task forces, right? And taking them to achieve that goal of tobacco cessation. We can go to the next one, please. So when you think about your partnerships, specifically for a task force, there's some key considerations that we want to leave you with. Is that when you're identifying these partners and you want to design this strategy to do tobacco cessation, maybe it is a task force, maybe it's a referral network, is that you have a clarity of purpose, a clarity of your goal, right? That when you are forming this task force, that you bring the expertise and have diversity on that expertise. And all of these are linked to the people that you serve and the specific challenges that they live, right? It's always recommended to have leadership members, and that the leadership is spread across different organizations. That does not all the leadership roles fall into one organization, because you want to have that authority spread, but also you want to have that engagement, right, from all the organizations that are present. You want to encourage commitment, accountability, and engagement. You want to bring resources, right? And also offer that support. Again, you want to have clear roles and responsibilities. And when I say clear roles, a lot of the task forces, if they are collecting funding, they have a treasurer, a vice president, a president, or a leader. They do have note takers and reporters. So it's important that whenever you bring someone to a table for a task force, that you provide these roles and they're also spread out, that there's flexibility and adaptability. And this is a big one, because when we have learned that a lot of task forces might not succeed, is because sometimes we might have a goal, and as we're going, they need to be some adjustment and shifting, and this is not working. And you need to encourage this flexibility and adaptability to change some strategies and towards the goal that you have. When we're doing tobacco cessation task force, if we're saying we're going to start with transportation, but you find out that your population or the agricultural workers do not trust ride shares. They don't want to jump into a stranger's car. So that's a shift. Okay, what else can we do to achieve these? So as you are seeing specific goals, you're going to see that you have to be flexible, and sometimes it's a trial and error, right? But we always say, as long as you're advancing and moving forward towards your goal and serving this population, that's what matters. And then everyone who's part of your task force and is contributing, it's with that kind of mentality and goal themselves as well. And then a very big one, and last but not least, is evaluation and reporting. When you have a partnership or a task force, it's important that we show the success, right? Because that helps to prove the value of your task force, the value of your initiative, but also it helps us have that decision makers buy in. A lot of the organizations, when you ask for a partnership or when you enter into an agreement to work together or collaborate, they do have to be approved by leadership or C-suite. So a lot of the times we need to show that it is working. We need to show that the partnerships are creating a return on investment, that our partnerships are creating success, right? That we're working towards achieving this goal. This also helps if we are looking to increase the funding within our location or our communities. A lot of the times, if we want to bring some of the governing bodies on board from our local, from our county or for our city, and we want to show like, hey, we've been doing all of this with this small population, and look at the success rates, they're learning. Maybe we're doing pre and post, or maybe we're doing any other kind of evaluations, and we're showing them, right, this is working. And maybe we request a bigger funding to do a whole city approach and increase this and make this strategy and go grow bigger and impact more people as we go. So we always say that it's very important that as you're building task forces, this is also applicable to coalitions, is that we do make sure that we have a system in place to evaluate the work that we're doing and also to show the success that we are doing. And always remember that it is a work in progress, and it takes a lot of hands on deck to achieve, especially when you have such a big goal as this, doing tobacco cessation within a population that might have very rigged traditions within themselves and cultural aspects. But it's not impossible if we have a lot of people working towards a goal. So we can go to the next one. So I know everything I shared was quite a bit. There's a lot of information, but you don't have to worry. I know there were a lot of links that we shared throughout the presentation, but this step by step, the 4 steps that I went through, you can find them in our guide for establishing collaborative relationships. It looks exactly like this. Within this guide, you're going to find all the links that we shared: the community asset mapping, the partner profile review. You're going to find the spectrum that we went through. You're going to find this type of different partnerships that you can choose to integrate on or engage on. And the link has just been shared right now in the chat. So feel free to download, and you're also going to find a page where you can take notes and actually make it actionable, especially if you're planning to do and integrate and establish some collaborative relationships for this. So we can go to the next one. So we hope that everything that we shared today was insightful, and that we encourage you to take steps to establish these partnerships and fight together. right, to raise awareness on tobacco use among MSAWs and bring organizations so we're stronger to promote tobacco cessation among MSAWs. Next, please. For those of you joining us through the video recording, this ends the content of the webinar. For those of you joining us live, please stay on for additional resources.